Good day, grade 10 students. Today, we are down to our last module for quarter 3, and that is our health class. So in connection and in continuation with our lesson last time, the health trends, issues, and concern, this time we will going to talk about recommendations or ways of adapting global health initiatives to local or national context. Okay? So local and national, including global initiatives. Okay? What do you think are the programs about health of the local government, the national government, and global initiatives. Okay? So, global health initiatives. Again, these are some of the global health initiatives organized by the World Health Organization or the WHO. The global fight against communicable diseases. We have the global fight against communicable diseases. Number one, we have rollback malaria. So, malaria class, usually we get infected with this through mosquitoes at night. Mosquitoes at night. So, that's why we have heard a lot of incident or experiences or testimonies of the soldiers because soldiers go and fight, have their duties at night, especially when they have their missions. Okay, so they usually go at night and then um, hide on the different, hide on the grasses, plants. So these places are the best place of the mosquitoes, right? So it is always at night. That's malaria. So rollback malaria is a global initiative that is being developed as a social movement which is intended to minimize the suffering caused by this disease. It's an action directed by the national authorities, assisted by all global partners, which includes banks, development agencies, private sectors, and group of researchers. Its aim is to educate people to recognize malaria promptly and take early proper action and to develop new anti-malarial products. Okay, next is we have to stop the TB, tuberculosis. Stop TB is a global effort which aims to provide cure to people living with TB. It also helps to prevent the spread of TB around the world by providing programs like TB Dots, short course strategy provided in every barangay. Next is we have Global Alliance for Vaccines and Immunization. The Global Alliance for Vaccines and Immunization, or the GAVI, G-A-V-I, is a global health initiative of the World Health Organization in partnership with the public and private sectors all over the world, which is dedicated to children's immunization for all. It also asserts to provide new vaccine to reduce the number of deaths caused by childhood meningitis, hepatitis B, influenza, yellow fever, pneumonia, and a lot more. This time class, vaccine is very famous because of the deadly pandemic, COVID-19. Government is actually giving us a free vaccine. So a lot of people doesn't like to get vaccinated because they're afraid of the effects, side effects of it. But the truth is, yes, there is always a side effect, but the government will never give something that the people will suffer. There is a side effect and all medication has effects. So vaccine is good. We encourage everyone to get vaccinated to support our immune system, especially the vaccine for COVID-19. But it does not necessarily mean that if we are already vaccinated, we cannot acquire anymore that disease. No, this vaccine is just a support to our body, to our immune system. If we encounter people who is infected with that virus, somehow it will support and boost our immune system not to acquire the said virus. Next is we have the Global Fund to Fight AIDS, TB, and Malaria. The Global Fund to Fight AIDS, TB, and Malaria is a funding project which aims to help provide preventions, reduction, and cure to all three infectious diseases. Through this initiative, many lives were saved and many were provided with free treatments and equipment like the antiretroviral therapy for HIV, TB dots, and distribution of mosquito nets for the prevention of the malaria. Next is we have Global Prevention and Control of Tobacco and Alcohol Use. WHO, World Health Organization, Framework Convention on Tobacco Control. It is the first international treaty which imposes the highest standard of promoting public health and providing new legal means for global health cooperation against the abusive and negative effects of tobacco. Next is we have Global Strategy to Reduce the Harmful Use of Alcohol. The global strategy to reduce the harmful use of any alcohol was supported by all 193 member nations of the World Health Organization. The serious health burden and its effects to all individuals and in the international scale was the main reason for this initiative. This initiative will provide awareness, commitment, and health services to reduce the negative consequences of alcohol intoxication. We also have Global Strategy for the Prevention and Control of Non-Communicable Diseases. The Global Strategy for the Prevention and Non-Communicable Diseases is a global action plan which urges to provide effective public health responses, prevention, and reduce the risk factors posed by all non-communicable diseases, which includes cardiovascular diseases, chronic respiratory diseases, and cancer. Also, diabetes. So see, if we just trust and support our government in this program, everything will be easy for us. Everything will be fine and everything will run smoothly. So let's grab the opportunity if the government gives us a free vaccines for the TB, vaccines for malaria, vaccines for dengue, vaccines for polio, and of course, the latest vaccine for the COVID-19. So, you also have to tell your parents, your relatives, that vaccines are good. These vaccines will never lead you to any failure because the aim of this vaccine is to help us, shield us from the different diseases or for a certain disease or virus. So did you understand? And the main lesson here is let us be healthy by doing the right things like eating the right kind of foods, do some exercise, follow the instructions of the government or even your barangay health center. They have health education. When they educate you of some things, please put it in your mind and accept it and learn from it. All of these things are for the good of everyone. So let's stay healthy, be healthy, stay at home, especially this time that we are all anxious about this certain virus. So let's follow protocol by social distancing, cover your mouth when you cough, wear your mask all the time, even if you're inside the house, and the face shield. Okay? Don't forget also to bring alcohol with you everywhere you go because it is very, very important that every now and then we have to apply alcohol in our hands to sanitize it and to make sure that the virus will never stick to our hands and we will not get infected of it. Did you understand? So thank you again, muchísimas gracias, grade 10 students. Let's stay healthy. Goodbye.